One of the important sessions at the Congress was the one dealing with myocardial infarction despite normal coronary arteriograms. That was a very well-attended session, and the main topics that were discussed were the mechanisms that lead to myocardial infarction without coronary artery disease, and we also tackled the problem how to deal with these patients. It was apparent that infarction with normal coronary artery affects approximately 6% of the women presenting with an acute MI, and approximately 1 to 13% of all patients coming to the attention of physicians with an acute coronary syndrome. The difficulty that was the difficulty in the diagnosis and management was highlighted, and this is because the MINOCA, this condition, encompasses very, very heterogeneous populations. So the consensus at the meeting was that it is an important entity, it is a real entity, is one that needs the attention of the physician, and is one that needs very specific research projects. And essentially the research should be based on creating large registries aimed at identifying the characteristics of these patients. And because the etiologies are so different, then we should actually try and identify the different subgroups, because each of these subgroups will require very specific treatment. So the consensus of the experts yesterday was that the condition is more frequent than we initially thought it was, that the prognosis is not as benign as we initially thought, and that treatment will have to be tailored to the individual patient.